So Lori called it, so I didn't know she gone.
I don't even remember who makes this beach chair.
Yeah.
Steris, I think it is.
So this is the old beach chair. It's just this piece. It used to have a headpiece, but we don't use it anymore. So when you're using this chair, the highest up you're going to actually ever sit it is probably 45 degrees, maybe even 30. So, well, I'll show you how we secure the head, but this piece here will slide out if they're really tall. It'll slide in, so you got that. So basically, what you want to do is spin the bed around. So this end is towards anesthesia. And the way this goes on the bed is it comes onto this side like that.
Robert knows that. You're gonna help him, Robert, on this side. You're an expert.
So, literally like that. So the thing you want to do is make sure, you see these little tabs right here? You don't want to see red on that tab, so you make sure it's pushed in all the way. Like that, and then it's locked. So you want it to be locked on both sides. Perfect. So when this is, you don't see red on these two levers, it's locked. So now basically the bed can go like this. So that's how you want it when you actually start to either raise the bed up or lower the bed. So what's going to bring the position up is you using the controller. You bringing the controller and doing leg up or leg down. So if we want to go up to 45 degrees, you would go leg up, and bring it to where you want it. So you're not going to go full 90. You're going to go about 45 to 30. So like, let's say if they're like, that's where they want it, you're going to then, do you mind passing me the jelly donut?
Do it Vanna style.
You're going to then use the jelly donut, and this is where it gets kind of weird. So some of your anesthesia providers will know how to do this, some of them won't, but the way we secure their head is we use Curlex. So you'll take Curlex and you just go basically over their head, around their chin, and then right across above their lip. Right across above their lip, this is the most stable place on the head that will secure them to this. So make sure you go one strip across above their lip, because actually it's going to be the most stable place as you wrap their head like that, and that'll keep their head. We're not going full 90 degrees, so you're not worried that they're going to go forward. They won't go forward. But once you have their head secured, the next thing you want to do is you want to lock the bed, okay? And so the way you lock the bed is you've got these little levers right here, and you just push them all the way in. The most important thing is you don't want to see red. You cannot see red. If you see red, it's going to fall, okay? So once you lock these, and it's locked, then you drop the leg. And you drop the leg all the way down. And so the reason why Dr. Edwards and some of the surgeons prefer to use this is this whole beach chair is radiolucent. And so when they're doing clavicles or certain fractures, the C-arm can literally come across and they can see right through it. The Arthrex beach chair is radiolucent, but it's got a column in the center. It's supposed to be radiolucent, but you can still see it, and it kind of blurs the image. So that's exactly how you want it to look when you're ready to start the case. So the most important thing is, just like when it comes to locking it, before you drop the foot, always make sure you don't loosen this until you bring the foot up. If you unlock this before this is up, this thing is going to go like that. This is going to slam down. And that's extremely dangerous to an intubated patient. So always bring it back up all the way.
We have to remember it's in reverse orientation.
Right. So right there, once you get to it, now you can loosen this. And you can just loosen it till you see the red. And then now, if anesthesia wants to bring the bed down, you can do it because the actual leg, the foot of the bed, is securing the captain's chair. So now you can go leg down if you want to bring them back to a normal supine position. Does anybody have any questions?